Hello my dear students, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. What are we going to learn today? We're going to learn the anterior triangle. Today I start my series on anterior triangle lectures. These are going to be divided as Introduction to Anterior Triangle, Muscular Triangle and Ansa Cervicalis, that is today. There'll be another lecture coming up on carotid triangle, on digastric triangle, submental triangle and suprahyoid muscles, and maybe one or more in case I find it necessary. So today we're going to talk about introduction to anterior triangle. So anterior triangle, its divisions and so on. Then we'll go on to discuss the muscular triangle. Then we'll talk about Ansa Cervicalis. Okay? One request to all of you dear students, whenever you're attending my lectures, try to sit with a color pencil, with drawing books or any other digital drawing implement so that when I ask you to draw, please do draw. Remember, by drawing you're using both sides of your brain. One is for learning, one is for the physical activity of drawing. It somehow results in better understanding and way better recall. So if you're doing this with me, then please do draw. A request from my side. Let's now begin the topic of an introduction to anterior triangle, muscular triangle and Ansa Cervicalis. Right. Before that, let's see if we can solve this very simple MCQ. Which muscle is innervated by Ansa Cervicalis? Sternocleidomastoid, anterior belly of digastric platysma and sternothyroid. The answer is very simple. Some of you probably already know it. Good for you. Some of you don't. You're still unsure. Sometimes you get a note on Ansa Cervicalis. To solve such MCQs or such questions, you need to have confirmed, clear concepts, knowledge. So let's dive into this and get that knowledge. Okay? Right. So, anterior triangle. As usual, my question is, where is the anterior triangle in your body? Okay. Let's always remember there is a sample of that human body item always with you. Okay. So let's talk about where is the anterior triangle. Remember, you have to palpate on yourself. It's a triangle. Okay. So it's going to have 3 borders. Remember that also. So the side of your neck, dear students, is divided by your sternocleidomastoid. Okay. Bend your head, turn it to another side. Can you see the sternocleidomastoid? Okay. So this sternocleidomastoid divides the side of your neck into an anterior triangle and a posterior triangle. So this region here, this depression below your mandible is called as the anterior triangle. Please palpate it, familiarize yourself with the anterior triangle region. Right. So students, let's now, because it's a triangle, it has got 3 borders. Okay. Its medial border is formed by a line joining the symphysis menti to your sternocleidomastoid. Please run your finger. All these midline structures help to form the anterior or medial border of anterior triangle. This is it. Okay. Running upwards from the suprasternal notch to the mastoid process is the posterior border formed by sternocleidomastoid muscle. Running across from your symphysis menti along the lower border of mandible to the angle of mandible and then drawing an imaginary line from your angle of mandible to the mastoid process. This is the superior border of the anterior triangle, sometimes referred to as the base of anterior triangle. Now you will say, if there is a base, where is the apex? Yes, the apex is at the lower end where there is a suprasternal notch. So you've now learned anterior boundary, posterior boundary, superior boundary / base and the apex of anterior triangle. So use the image to help you along the way. Right. So since we've introduced the midline structures, I want you to understand the midline structures of the neck. Okay. So please look at the image here and see if you can palpate these structures wherever possible. Symphysis menti here. A fibrous midline raphe extending from symphysis menti to your hyoid bone. So that's your hyoid bone. Okay. Come down thyrohyoid membrane to the thyroid cartilage. Can you feel your thyroid cartilage, everyone? Go down, conus elasticus to the cricoid cartilage. Below that now a lot of tracheal rings. I'm sure you can feel your tracheal rings crossed by the isthmus of thyroid gland. As you continue down, you cannot feel the jugular venous arch, but it's there. And finally, the suprasternal notch. All these are the midline structures of the neck, forming the anterior boundary of the anterior triangle. Sternocleidomastoid forms the posterior boundary, and the mandible, along with an imaginary line to the mastoid process, forms the base of the triangle. I'm going to remove this, and what is left is what you're going to draw. Please draw quickly, students. Draw the anterior boundary. If you can't draw it the way I've drawn it, you can draw a straight line, no problem. Draw the posterior boundary. Draw the superior boundary, and that's your triangle. You have your anterior triangle there. If you want to write what is forming which boundary, you can write the sternocleidomastoid here. You can write the mandible and imaginary line here. You can write the midline structures there. That's up to you. Now let's go to the next image. Okay. Understand that if it's a triangle, it has to have a roof. Okay. As a student of anatomy, you are usually dissecting the cadaver. So what do you see on the cadaver in anterior triangle? You see the skin, correct? Then you take an incision in the skin. When you remove the skin, what do you come to? Superficial fascia. When you go through the structures in superficial fascia, what lies deep to it? Deep fascia. Therefore, my dear students, your anterior triangle roof is formed by skin, superficial fascia, and deep fascia. But is superficial fascia empty? No. There are a lot of structures in it, such as fat, nerves, blood vessels. What else? Let's take a look. Fat. Platysma. Are you okay with having platysma here in your superficial fascia? Yes, because in the face you have muscles in your superficial fascia. Cutaneous nerves such as the transverse cervical cutaneous coming from posterior triangle and the cervical branch of facial coming from the parotid gland. Anterior jugular veins, submental lymph nodes. These are structures which are present in the superficial fascia in the roof of this region. Let's now talk about the divisions of anterior triangle. We've got a large triangle, okay? Now you are seeing there are several lines on the screen. Let's see what those lines are. This is the posterior belly of digastric. This is the anterior belly of digastric. This is the superior belly of omohyoid, and this is your hyoid bone. This is the triangle you have drawn. Now draw these muscles there. This is the hyoid bone. This is the posterior belly of digastric and the anterior belly of digastric. The area now delineated over here by posterior belly, anterior belly and the base is called as the digastric triangle. What are the boundaries of digastric triangle? The base of anterior triangle, posterior belly of digastric, anterior belly of digastric. Have you got it? Okay. Similarly here, please draw the superior belly of omohyoid. Again, a new triangle is formed called as the carotid triangle. In the front, another triangle gets formed called as the muscular triangle. And here on the top, a tiny little triangle is formed which is half of the submental triangle. So, submental triangle will be bound by anterior belly of digastric on both the sides and then bound below by the hyoid bone. If you've drawn this, let's continue. This is what it looks like in the living being. Finally, we have divided our anterior triangle, students, into 3.5 triangles. What are the 3.5 triangles? Close to the base, digastric. Along the sternocleidomastoid, carotid. Close to the midline, muscular. And above the hyoid, submental. 3.5 triangles. Let's revise what we've covered up till now, students. We introduced the anterior triangle. We palpated it on ourselves, remember? Then we talked about its anterior border, posterior border, superior border and the apex. Then we talked about structures in the roof of anterior triangle: skin, superficial fascia, deep fascia. Then we divided the anterior triangle with the help of digastric muscle, omohyoid muscle, and hyoid bones into 3.5 triangles. What were the 3.5 triangles? Digastric, muscular, carotid, and half of submental. These were the 3.5 triangles. Today now, we are going to go and talk about the muscular triangle. The others will be covered as individual lectures subsequently. So let's go to the muscular triangle, students. You want to take a pause? Drink some water maybe? Okay. Always relax and study. Don't study under pressure. There's no fun in it. And if you're not having fun, if you're not enjoying, this also becomes a chore. I don't want you to study because it's a job. Study because you want to learn. Okay. That's being a bit idealistic, but at least don't stress when you're studying. Okay. All right. If you had some water, let's continue. So I hope you've had some water. Relaxed. Let's begin. Now I'm going to talk about the small little triangle in your neck, the muscular triangle. Okay. Are you ready, students? Let's begin then. If it's a triangle, it has to have 3 boundaries, correct? So again, you have a midline boundary, a boundary in the midline extending from your hyoid bone there, okay, here, down to the level of the suprasternal notch. That is the anterior boundary. A little bit of this lower end of the sternocleidomastoid forms the posterior-inferior boundary, and the superior belly of omohyoid forms the posterior-superior boundary. So 3 borders, okay, or 3 boundaries: anterior midline of the neck, anterior border of sternocleidomastoid, superior belly of omohyoid. These are the 3 boundaries of your muscular triangle. So as usual, we are going to talk about the roof. If it's a triangle, then it has to have a roof. So skin, superficial fascia, deep fascia. I hope you have your concepts very clear now. If there's any triangle, these are the 3 roofs you're going to get in the neck: skin, superficial fascia, deep fascia. But what is special in the superficial fascia here? Okay, what is special? Come take a look. You can see this is the triangle. You can see the anterior jugular veins in the midline, and you can see them joined here with the help of a jugular venous arch. So these are 2 structures that are also of clinical importance. Just imagine you're manipulating in this region. What are the chances of your cutting these veins? It's pretty high. So this is stuff that must come in your answers. Okay, any endless number of mugged up answers are of no use to you. You have to remember here, these are the 2 venous structures that are critical. You cannot enjoy them. So that's the roof of muscular triangle. Now let's go to the floor. Remember, in this image, one side you are seeing superficial muscles here, and on the other side you are seeing the deep muscles. Okay. So the floor is formed by superficially by sternohyoid muscle and the omohyoid muscle. On a deeper plane, it's formed by sternothyroid and the thyrohyoid muscles. These are structures, 2 muscles in the front and 2 muscles behind, superficial and deep. We'll be talking more about it. Just remember, all these 4 muscles together are referred to as infrahyoid muscles. Below the hyoid, infrahyoid muscles. That's the triangle. Right. So now what are the contents? What have we done? We've done the boundaries, we've done the roof, we've done the floor, formed by superficially by 2 muscles, deep by 2 muscles. So what are the contents? Most books say that there are no important contents. Only the infrahyoid muscles themselves can be called as contents. Some books have talked about larynx and thyroid gland as the content. Okay. So let's revise the muscular triangle. Don't think we're done. I'm just taking you down to a point where you feel connected. Okay. So muscular triangle has been discussed, its boundaries: midline, posterior-inferior, posterior-superior. Then we talked about the roof, in which I reminded you that anterior jugular veins and jugular venous arch are two things you must remember. Then we talked about the floor, which is formed by the 4 infrahyoid muscles, 2 superficial, 2 deep. We will be discussing these subsequently in today's class. Then we talked about the content, and finally we go on to our discussion on these very infrahyoid muscles. Okay, so these infrahyoid muscles are classified as strap muscles. Okay, you know, you're all familiar with infrahyoid muscles. So many times elderly people, I'm sorry, but that includes me nowadays. Okay, so when we take a deep breath, or sometimes we move, you will see 2 longitudinal muscles becoming prominent in the neck, and you might see it in me as well. These are the infrahyoid muscles or strap muscles. Okay, right. How many of them? There are 4 of them, 4 pairs on each side. Can you name them? Yes, I can. They are sternohyoid, omohyoid. Remember, hyoid, hyoid. Sternohyoid, omohyoid. Sternothyroid, thyrohyoid. Divided into 2 groups, superficial and deep. Okay, so let's use our hands. Maybe it will help us. Okay, superficially, I have got sternohyoid, omohyoid, right next to each other. When I remove these, I get sternothyroid and thyrohyoid. Sternohyoid, omohyoid next to each other. When they are removed, you have on a deeper plane sternothyroid and thyrohyoid, one above the other. I hope that helped. If it doesn't, forget it. Okay, so divided into 2 groups, superficial and deep. Let's talk about the superficial group of muscles. Come on the screen, dear students. Here you can see your sternohyoid muscle taking origin from manubrium sterni and from the clavicle, passing vertically upwards to get attached to the lower border of hyoid bone. Next to it, in between them, you can see the Adam's apple. In the males, it can be clearly visualized. On the side here, right next to it, is the superior belly of omohyoid. It also has an inferior belly, which you have probably seen in the posterior triangle. If you have not, then you should have seen it. Joined by the intermediate tendon, which lies deep to the sternocleidomastoid muscle. These 2 muscles lie edge to edge. They lie edge to edge, okay? And they converge on to the hyoid bone, right? So that's the first 2 muscles, sternohyoid, omohyoid. Let's remove both of them. What do we find below? Right. So what I find below is sternothyroid and thyrohyoid sitting one on top of the other. Sternothyroid passing upwards from the manubrium sterni to the thyroid cartilage, the oblique line on thyroid cartilage. From here upwards passes your thyrohyoid, which gets attached to the lower border of the hyoid bone. So they sit one on top of the other in this way, linearly oriented. Posterior to the sternothyroid is the thyroid gland. Take a look, right? Now this is an important relation, students. Come on, let's understand why. Now this is a coronal section that you're seeing, and that's the thyroid cartilage. That point is the oblique line of thyroid cartilage. Attached to it anteriorly is the sternothyroid. Posteriorly is a muscle called inferior constrictor. Please use your hands. Create something like this. Okay. Can you see that in the V-shaped gap between the inferior constrictor and the sternothyroid, the thyroid gland is sandwiched? Yeah. Immediately, the moment I say sandwich, you probably want to eat. Okay. But let's forget about that. I'm sure you'll get to eat. First, think of the thyroid gland sandwich. Okay, so superficially there is sternothyroid. On the deep side, there is the inferior constrictor. So you will wonder, how does it matter? Of course, it matters, students. Now just imagine that this thyroid gland decides to enlarge. Okay, can it grow upwards? It cannot grow upwards because it's stuck between these 2 muscles. So what does it do? Take a look. It grows downwards and expands downwards. That's why you have thyroid swellings in your neck hanging below. Okay? So that's how anatomy helps you to understand illnesses. Okay? It cannot grow upwards because it is sandwiched between the sternothyroid and the inferior constrictor. Right. So Here we complete the anatomy of infrahyoid muscles. What is the action of these muscles? These are muscles which mobilize your hyoid bone and thyroid cartilage during vocalization, as in speaking, during swallowing, and during chewing movement or mastication. Okay? So with this, we complete the anatomy of infrahyoid muscles. We now go to its nerve supply. These four muscles have nerve supply coming from one branch of hypoglossal nerve and another nerve called Ansa Cervicalis. What is there to discuss? Yes, there is a lot to discuss here. Let's move on to the last part of today's class, Ansa Cervicalis or Ansa Hypoglossi. As usual, what do I tell you? Introduce it to yourself. So first question, what is an Ansa? Ansa means a loop. So whatever we are doing, it's going to be a loop of nerve. Okay. What is Ansa Cervicalis? It's a loop of nerves formed by cervical spinal nerves, hence called Ansa Cervicalis. So branches which are cervical spinal nerves come and form a loop. Why is it taught with infrahyoid muscles? I think by now you know it is taught because it supplies the infrahyoid muscles. Right. So, very complicated looking image, isn't it? Believe me, at the end of next 10 minutes, you're going to know this in and out. It's not complicated at all. Okay. Look at it now. See that it seems to consist of two parts, a superior root and an inferior root, and this is the loop of Ansa. Okay, broad outline, you got it? Let's now begin to discuss it in bits. Sometimes that's the better way of learning. Right, so let's talk about fibers coming from C1 spinal nerve. Okay, Ansa cervicalis is essentially a loop formed by fibers coming from C1, C2 and C3. So I'm going to divide it into fibers from C1 and fibers from C2, C3. Okay, so fibers from C1. Fibers from C1 began their journey trying to reach the infrahyoid. But they had a long distance. Infrahyoid muscles are here. The nerves are taking origin from your spinal cord. So, while they were descending, on the way, they found that hypoglossal nerve is going towards the same region. So, what did they do? What is this called as? It's called as asking for a lift, isn't it? It's called as hitchhiking. So, what did they do? They asked the hypoglossal nerve for a lift, isn't it? So you can see how the C1 fibers now begin to quietly travel with the hypoglossal nerve, not mixing with it, just traveling with it. And as they begin to travel downwards, they give rise to variable branches. Okay, so that C1 fiber traveling along with the hypoglossal nerve, hitchhiking, dear students. Okay, don't do it, okay? Don't ever hitchhike. But I'm just telling you a concept. What happens is they give rise to branches. The branches they give rise to are one, meningeal branch going to the meninges, a superior root of Ansa cervicalis going to supply superior belly of omohyoid. Out of our four infrahyoid muscles, one has received nerve supply. Leftover nerve travels forward and goes on to supply here the thyrohyoid and then the geniohyoid. So, second muscle of infrahyoid receiving its nerve supply. So, we've got superior belly of omohyoid, we've got thyrohyoid supplied both by C1 fibers, out of which only one got supplied by Ansa. Did you note that? Which one was supplied by Ansa? The superior belly of omohyoid. Okay, we'll revise this, don't worry. Let's go to the fibers coming from C2, C3. Before that, the term I want you to remember, yes, hitchhiking. Who is hitchhiking with whom? C1 is hitchhiking with 12th cranial nerve. Right. Let's now go to C2, C3 fibers. As you can see, fibers from C2 and fibers from C3 begin to travel together, forming what is called as the inferior root, also called as Descendens cervicalis. This inferior root meets with the superior root to form a loop, which is called as the Ansa cervicalis. Okay, this goes on to supply the inferior belly of omohyoid, sternothyroid and sternohyoid. You saw that all the muscles of infrahyoid muscles are now receiving their nerve supply. Right. So let's quickly revise and then we'll be drawing this, okay? So the revision is C1, C2, C3 fiber nerves are there. Fibers from C1 begin to travel with hypoglossal nerve hitchhike, and then the fibers descend downwards, forming the superior root of Ansa cervicalis. C2, C3 unite to form the inferior root of Ansa cervicalis. They unite to form a loop which is called as Ansa cervicalis. They give rise to branches which supply inferior belly of omohyoid, sternothyroid, sternohyoid, superior belly of omohyoid, and leftover fibers of C1 go on to supply the thyrohyoid. This is how cervical branches supply infrahyoid muscles. Also, we are seeing leftover C1 supplying geniohyoid. And just for your information, you can see fibers coming from C4, C5 and C3 uniting to form the phrenic nerve. Okay? Alright, you can remember that information or you may not. We'll now go on to draw the Ansa cervicalis. You'll be surprised how easily you remember this information. Are you ready, dear students? Come on, get your drawing pencils out and we will start a diagram. Okay? Sure. Okay, students, I hope you're ready. Let's begin by drawing first the loops of C1 and C2, C3. So write down C1, write C2, write C3. Okay. Get the loop from C1 and C2 to move forwards. That from C2, C3 and the C3, C4 loops are posteriorly oriented. Fibers from C1 begin to travel downwards. As they travel downwards, they meet the hypoglossal nerve which was going towards the tongue. The fibers of C1 hitchhike along with the hypoglossal nerve. While traveling downwards, they give rise to their first branch, the meningeal branch. As they descend downwards, they give rise to the superior root of Ansa cervicalis, and then they continue forwards to supply the thyrohyoid and the geniohyoid. The superior root gives rise to branch to the superior belly of omohyoid. Now let's talk about fibers coming from C2 and from C3. These fibers unite to form the inferior root of Ansa. The inferior root meets with the superior root, forming a loop which is called as the Ansa cervicalis. From the inferior root, you can see a branch going to the inferior belly of omohyoid, sternothyroid, and the sternohyoid. This very simply is the diagram of Ansa cervicalis. You can now go on labeling it to your heart's content, but this is what it's all about. Okay. Thank you, students. Let's come back to the screen now. Right. Let's now talk about the relations of Ansa cervicalis. The Ansa cervicalis is actually embedded in the anterior wall of carotid sheath. I want all of you to see how this here at the back is your carotid sheath containing internal jugular vein and common carotid and internal carotid artery. In between, you can see the vagus nerve as well. And this here is the loop of Ansa cervicalis, which is embedded in its anterior wall. Let's see if you can solve this MCQ, students. Which muscle is innervated by Ansa cervicalis? We started with this MCQ, remember? Now I'm confident that you know the answer. You know, of course, the answer is sternothyroid. Similarly, Ansa cervicalis supplies all these muscles except omohyoid, stylohyoid, sternohyoid, thyrohyoid, sternothyroid. They all seem the same, isn't it? Yes, but you know, stylohyoid is not supplied by Ansa. That's the answer. Right. So with this, we come to the applied anatomy for Ansa cervicalis. Ansa is sometimes developing schwannomas. This is a rare thing. Ansa cervicalis is a loop which can be used to re-innervate your laryngeal muscles in case of damage to your recurrent laryngeal nerve, which sometimes happens when we are operating for esophageal cancers. It is also damaged during surgical procedures such as thyroplasty, such as surgeries of the parotid gland, and sometimes surgeries which are done to remove deep cervical lymph nodes. Okay? Where muscular triangle is concerned, the applied anatomy you should remember is any midline approach. Remember, I'm telling you something very important. While muscular triangle hardly has any contents, okay? Remember, this is the area which is being used to approach these important midline structures. Your trachea, your larynx are approached this way, and your thyroid gland. So whenever you're approaching from here, you will have to go in and reflect your sternothyroid and sternohyoid muscles laterally and expose these midline structures, namely the larynx, including the thyroid and cricoid cartilage, the thyroid isthmus across the tracheal rings and all the tracheal rings themselves. During this time, it is possible that you may damage the inferior thyroid veins or the jugular veins, like I told you earlier. Also, knowing this anatomy is crucial when you do the emergency surgery of tracheostomy. Remember, you don't have much time. You don't have the time to read up books and understand the anatomy when you're approaching to do a tracheostomy. So know this anatomy well. Remember, the trachea is quite superficial in the upper part of muscular triangle and quite deep. In case you go for a tracheostomy at a lower level, you would have to go in quite deep. Okay, so that completes the topic of muscular triangle and Ansa cervicalis. Today we learnt about the boundaries of anterior triangle. We discussed the muscular triangle, its applied anatomy, and Ansa cervicalis with its applied anatomy. Okay, I want to see you students for my lectures on carotid triangle, for my lectures on digastric triangle and submental and suprahyoid muscles. Please study these well. These are structures on which a lot of exams are conducted and a lot of MCQs are placed for students. Finally, the way I see it, if you want the rainbow, you've got to put up with the rain, students. So if you want to be able to solve questions well, perform well in exams, you've got to study hard. You've got to, my advice is, enjoy the process of studying. All right. Thank you, students. I enjoyed myself as usual. I hope you did too. Please practice your drawings well. It will help you to have a better recall of anatomy. Thank you. I'll see you across the screen in some other video. Bye.